Before we start our newborn assessment, this is a newborn child and they just came out of the womb. We're going to perform hand hygiene. We're going to don some gloves. So we normally with vitals you would take a blood pressure, but I don't have a blood pressure cuff. Normally for a baby, their blood pressure could range from the diastolic being 45 to 65 and the systolic from being 65 to 95. All right, and then we're gonna take her pulse on the brachial pulse. A newborn's pulse normally ranges between 110 to 160, but however, when they're newborn, it may be a little higher, even up to 180. And then we are going to have a pulse ox on their toe. A pulse ox for a newborn normally ranges between 95 to 100%. And then we are going to count their respirations for a full minute. So for a newborn, their respirations can range between 30 breaths per minute to 60. So would do it for a full minute. All right, so first we would look at the overall color. We would feel the skin of the child. Normally they have Vernix caseosa on them, which is normal. It's like this white substance and it will peel off naturally. We look for stork bite around the face, any bruising, Mila on the face, and Nevi simplex, and lanugo on the arms. So another normal finding would be blueness in the hands or toes. That's called acrocyanosis. So now we are going to, while the newborn is exposed to air, we're going to measure. So we're going to start by extending the legs down. Normally they'd be bent. So a newborn ranges from 18 to 22 inches long, and their head we're going to do right above the eyebrow line, which is normally 12.5 to 14.5 inches. Then we are going to measure the torso at the nipple line, and this is normally 12 to 14 inches. So let's say we got 13.5 for the head, we would get 12 for the torso, which is within normal limits, and the torso is normally smaller than the head. Then we would measure the nipple, just because we have our measuring tape out. The nipple is normally 0.5 centimeters to 1 centimeters. And just looking at the nipple, there's normally just some engorgement, and that's due to the mother's hormones. This will eventually go down. Now we're going to cover the newborn back up, and we are going to take a look at their sutures. So we're going to feel the flat, soft palates, and normally you might be able to feel a pulse within them, and that is a normal finding. We also might look for caput, which is fluid around the head, and that is normal. It normally disappears within 24 to 48 hours. There also might be a hematoma, which will eventually disappear. All right, now we're going to look at the symmetry of the face. The eyebrows aligned, the eyes are aligned, nose, and look at the overall color of the face, see if we see any stork bites or forceps marks. All right, now we're going to take a look at the eyes. So we're going to look at the eyes, make sure they're aligned. If they aren't, it's normally a sign of strabismus. Then we're going to look at the color, which is normally blue of the iris and then gray of the sclera. We might check the conjunctiva. And then we're going to test the eyes for accommodation to light. Okay. And then we are going to test the sucking or the rooting reflex, and she's going to turn and suck my finger, and then we are going to test the mares. So during this we might also look at their belly to see if there's any breathing. Alright, so we're going to plug up each mare. Okay, check for patency. We're going to feel around in here the large and the soft palate. Careful not to hit their gag reflex. And then we are going to take a look within their mouth. And we're going to look around. We're going to look at the tongue, see if it's midline. We're going to see the back of the uvula. We're going to make sure that's midline. We're going to check for teeth. Normally they'd remove the teeth here. And then we'll check for attachment of the tongue. Now we're going to check for hearing. So we're going to see if the baby reacts on this side. Okay, and the baby did react on each side by the turn. Alright, now we are going to check the neck for range of motion. So we're going to turn the head side to side. Now we're going to feel for masses on both sides. And then we're going to feel the clavicles. If we hear clicking, that is a sign that they are broken. And then we're also going to pinch the skin turgor, and normally this snaps back immediately. So now we're going to check the arms. We're going to feel the temperature. We're going to feel the tone of them. And then we're going to bend them and see if they bend them back for that flexion reflex. And then we are going to look at the overall color, see if there's acrocyanosis in the hands. And then we are going to stick our finger in the hand, and normally they will grab your finger, and that is known as the grasp reflex. We'll also look for webbing of the fingers, and we are going to look at the nails, see if they're too long, because that could be a hazard to them. Okay, and feel for symmetry around here. Alright. Next, we are going to check the pulses. So you have your brachial pulses right here. Feel for them both sides. And we're going to check their femoral pulses. And now we're going to take a listen to her. So first I'm going to warm up my stethoscope before I put it on the child. And then we're going to listen for the point of maximal impulse, which we would leave it there, which is normally down here, for a full minute. If you observe any murmurs, that is normal for a child. Alright, well, I have my stethoscope out. I'm going to listen to her lungs. If she's crying too loud, I might have her suck my finger. Or do this at a time where she's a little quieter. And there are 4 places on both sides. We're listening for rhonchi or crackles within the lungs we don't want to find them. Okay, so while I have my stethoscope out, I am going to listen to her belly. So we're going to start down in the first quadrant. We're going to listen for 30 seconds. Okay. And then we are going to look at the umbilicus. So normally at this point we would count the veins before we clip it. Normally there's 3, so let's say there's 3 with her. And then we're going to palpate the stomach. And normally around here you can feel the liver. Alright. And now we are going to look at the legs. So you're going to perform Barlow's maneuver. You're going to bend the legs and then you're going to flex them out, and you don't want to hear any clicking noises. So if you hear clicking, that's a sign of hip dislocation. You can also tell that by looking at the folds of the leg to see if they're even on both sides. Or when you bend the legs forward and then, or pull them out and push them, have them bend back, one might not go all the way. So we're going to look for the range of motion. Are they able to move? And then we're going to feel the tone. We're going to feel the temperature. We're going to look at the color, see if there's any nevi simplex on the legs that we didn't notice before. And now we're going to look at the foot. This might be a little painful for the doll. So on the foot, we're going to look at the creases. It normally covers 2/3 of the foot. And we are going to do Babinski's reflex. So normally for a baby, their toes are going to flare outward, and that is a normal finding for them. And then we're also going to stick our finger here, and they're going to have the plantar grasp. So, and now we're going to look at the private area. So for a female, you would see the labia majora cover the vagina, and that's normal because of the mom's hormones. You might also see white discharge or pseudomenses. For a male, you might notice that the scrotum has rugae, and that's a sign of maturity. If it's soft, that might be a sign that they were premature. The color of it for a male is going to be, like a white male is going to be pink. For a dark brown, African American. Then we're going to feel the testes and feel for their intactness. Alright. Now we are going to flip the newborn over. And we're going to check, this is a side view, but normally we'd be holding them like this. But we're going to check for overall curvature of the newborn, which should curve like this. And then we're going to perform the standing or the reflex. So they should be planting their feet on the ground and almost walking, but they're not able to walk yet. And then we're going to place them on their front. So from here, you can also look at the back leg wrinkles, and you can look at the back side of the limbs. So we're going to look at the symmetry of the scapula back here. We're going to feel them, make sure they are intact and there's no clicking. And also we are able to look at the ear and the eye. The ears are not lower than the eyes. And we're also able to look at the back of the head, the fontanelles for swelling at this point. So we're looking at the scapula, and we're gonna feel the spine and work our way down and make sure it's intact. And then we're gonna look at the back sacral area. This area might have lanugo, or it may have outpouching. That is a sign of spina bifida, but the lanugo may be totally normal for the child. And then we are going to take this opportunity while they are on their front side to listen to their lungs. So we're going to warm up the stethoscope again because it probably got cold. And we're going to take a listen. And then we are going to flip them back over. So normally that they're in like a little box thing, but I don't have a box, so we're just gonna do Moro's reflex. So in this, when they get startled, we want to see a curvature of the hands. So for the newborn, we would startle them by like lifting their little carrier or their bed, and then we would flip it down, and normally you would see the hands kind of flare out. And then we would cover them back up, and we would bring them to their mother if they are ready, because we want to keep that contact as soon as possible. And we doff my gloves, perform hand hygiene, document my findings, and I would also make sure to get identification on this child.